candidate for hair replacement, either the medical management or the surgical side of things. Now, obviously, without being a smart aleck, it's somebody with hair loss, but there are some distinctions to make there. Male pattern baldness, let's start with that. With male pattern baldness, the thing that you have to be careful with and the thing that you have to think about is, what stage is the individual at in terms of hair loss, and what is the projected hair loss in the future. The general concept with surgical management is that you only have so much donor hair available that you can actually physically move from the donor site, which is typically in a strip like this on men, to the needed areas. You do not want to try to recreate the hairline of a 14-year-old boy in a 35-year-old man. First of all, it looks weird. Second of all, it's not maintainable over time. There are things that we will talk about to try to maintain and prevent future hair loss. If that is not followed or done, or if the patient's response to that is not as expected, what happens is you get this hair loss with the exception of what's been grafted. The grafted hair does not go away. So the hair loss pattern could require additional surgical intervention or additional grafting procedures in order to get back to a more natural look. For women, it's a little more difficult. With women, the hair loss tends to be more generalized. Now, whenever a woman comes in, or a man comes in with hair loss, you always want to be thinking about possible medical issues besides alopecia or just generic male pattern baldness. There can be different medical conditions that can cause that, such as thyroid problems or alopecia areata. There's different things. And so you have to be thinking about those, particularly in women. Women's hair loss patterns tend to be more diffuse. It's not your typical male pattern baldness. So that makes it more difficult in terms of acquiring donor hair. If you have thinning out everywhere, you don't want to borrow hair or take hair from somewhere and make it even thinner to make another area look thicker. So we'll get more into that when we talk about the surgical side of things. It does become much more important and much more useful for women to do non-surgical interventions. Things like medical management that include medications such as topical minoxidil, topical Propecia. There is oral Propecia or finasteride. We'll talk about that as well in the context of women and men. Laser caps and laser therapy, as well as natural supplements. So we'll go through all of these things and start with our first one in terms of medical management, which will be topical agents. So the question, that I get and that you're probably wondering is, okay, what kind of non-surgical options do you have, do I have, do we have to treat hair loss? So there are a number of different things, and the things that I'm going to tell you about and talk about have been FDA approved and have been researched and are legitimate things that can be done to minimize future hair loss, to take miniaturization, or basically hairs that have become smaller and smaller over time and are perhaps now fine baby hairs, to turn those back into what are called terminal hairs. So to go from what are called vellus or baby hairs to terminal hairs, which essentially looks like you've gained more hair just because you've taken little fine hairs that were really not very visible and making them into mature, normal terminal hairs. So let's talk about topical agents such as minoxidil, also known as topical Rogaine, and finasteride. So finasteride, or the brand name for that is called Propecia, can be used topically along with Rogaine or minoxidil. Minoxidil is very well researched and has been shown to minimize future hair loss, to help take the baby hairs and make them into more coarse and more visible hair, which essentially minimizes future hair loss as well as increasing hair density. Propecia is typically taken orally, and it's 1 milligram. There is a study out of Europe that shows taking topical Rogaine or minoxidil and using topical finasteride and combining those two gets a better result than just the topical minoxidil alone. So it gets a little confusing, but basically these two agents can be used topically and can be placed on the hair loss area to help minimize future hair loss but also to thicken up the baby hairs. Oral medications, and specifically finasteride, prevents the conversion of testosterone into 5-DHT, which is a type of testosterone that, when it attaches onto a susceptible hair follicle, will lead to miniaturization of that hair and eventually shedding and loss of that hair follicle. By taking this medication at 1 milligram a day, it has been shown in the studies to minimize future hair loss and also to take miniaturized hairs and cause them to become more terminal and more robust hairs. There are some side effects with these oral medications. The biggest ones are ED, erectile dysfunction, and a loss of sexual libido as well. So it's important, to kind of consider, these potential side effects. Now, using these medications topically does not have those side effects. It is acceptable and safe for women to use these medications topically. That includes the Rogaine, and it also includes topical finasteride. It is possible for women in menopause to take Propecia orally as well. This should never be taken in women of childbearing age.